This video will review the personal protective equipment and proper donning and doffing method for full precautions. Full precautions incorporates airborne, droplet, and contact precautions. The personal protective equipment, or PPE, required for full precautions are a fluid-resistant gown, an N95 fit-tested respirator, a face shield, and gloves. Prior to donning PPE, please read the isolation sign posted at the door to familiarize yourself with the type of isolation and components of PPE required. To begin, remove jewelry and tie back hair if applicable. First, perform hand hygiene using alcohol-based sanitizer. Rub hands together for a minimum of 15 seconds, ensuring coverage between fingers, around and under nails, on palms, back of hands, thumbs, and wrists. Continue rubbing hands until dry. Take a fluid-resistant isolation gown from the isolation cart. Perform a visual inspection to ensure there is no damage. When putting on the gown, ensure that both the neck and mid-back ties are tied as tightly as possible, so that clothing is fully covered and the gown does not drape when providing care. Select your fit-tested N95 respirator. Ensure that you are clean-shaven. Place the respirator over your nose and mouth. Pull the bottom elastic over the head first and place it on the back of the neck on bare skin. Then pull the top elastic over and place it at the crown of the head. With your fingers, firmly press the metal strip around the nose to ensure the respirator is sealed to your face. Perform a seal check by quickly inhaling and exhaling. If you feel air escaping around the edges of the respirator, press the metal strip around the nose again to adjust the fit. Take a face shield. If there is a film, peel off the film. Place the foam strip on your forehead and pull the elastic around the back of the head. Ensure that the foam strip is on the middle of your forehead so that the face shield sits properly on your face. Put on the gloves. Pull the gloves over the cuffs of the gown so that your wrists are fully covered. You are now ready to enter the room. Doffing your PPE. Upon leaving the patient's room, enter the anteroom to doff your PPE. Take your time doffing your PPE correctly to avoid contaminating yourself. First, remove your gloves using the glove-to-glove, skin-to-skin technique. Pinch one glove and pull the glove down and away with your other gloved hand. Gather the removed glove into your gloved hand. With your bare hand, put your fingers under the glove of your hand and pull down and away. Throw gloves in the garbage bin. If you think you may have contaminated your hands while removing your gloves, you can perform hand hygiene at this time. Next, remove your gown. Untie both ties of the neck and mid-back. Carefully pull gown from behind shoulders and down your arms, away from your body. Fold gown inwards and roll into a ball. Place in soiled linen cart. Perform hand hygiene for 15 seconds. Remove face shield by grabbing elastic at the back of the head. Remember to avoid touching the front of the face shield when removing. Pull elastic overhead and pull face shield down and away from the face. Place face shield into garbage bin. Remove N95 respirator by pulling a bottom elastic up and overhead. Next, pull top elastic overhead and away from face. Do not touch the front of the respirator. Place respirator into garbage bin. Finally, perform hand hygiene for 15 seconds. You are now ready to proceed to your next task.